Neonatal sepsis is one of the major causes of neonatal death. Hand hygiene is the simplest method to prevent and control the spread of infection in SNCU. In this video, we shall learn about hand hygiene. Hand hygiene can be achieved through hand washing using soap and water and hand rub using alcohol-based formulation. Let us first learn the 5 movements in which the hand washing is indicated. Before touching a patient, before clean or aseptic procedure, after exposure to a body fluid, after touching a patient, and after touching patient's surrounding. Each unit should have adequate facilities for hand hygiene, which include uninterrupted water supply, deep and wide sink to avoid water splash, and elbow operated taps. Soap, preferably a liquid soap dispenser or a alcohol based formulation, sterile single use towel or sterile tissue paper if available to wipe the hands at the end. WHO 2009 posters on method of hand washing, method of hand rub and 5 movements of hand hygiene, and a clock with seconds hand near the basin to increase the compliance to the timing of hand hygiene. According to WHO, hand washing should be done for 40 to 60 seconds and hand rub for 20 to 30 seconds. Either of the 2 methods of hand hygiene can be used. However, hand washing is preferred over hand rub in cases of entry into the SNCU and when the hands are visibly dirty or soiled with blood or body fluids. The prerequisites before hand hygiene are: remove the wristwatch, bangles and rings. The sleeves should be rolled up at least 1 inch above the elbow. Wet the hands and the forearm with water and take adequate amount of liquid soap in the cupped palm. In case of hand rub, take the adequate amount of alcohol based hand rub, that is approximately 5 to 7 ml in a cupped palm. Now gently rub all the hand surfaces including wrist, forearm and elbow. Let us learn a simple way to remember all the steps of hand hygiene. These steps can be remembered by a mnemonic Suiman. Each step has to be done 5 times. Suiman stands for S, that is Seedha, U, Ulta, I, interlocking, M, muthi, A, angutha, and N, nakhun. After performing the 6 steps of Suiman, wash your hands under the running water. Always keep hands at a higher level than the elbow so that the water trickles down from the clean area towards the forearm. Close the tap using elbow and air dry the hands by keeping them vertically or by using a single-use sterile napkin or a sterile paper if available. Always wait for the hands to be completely dry before touching the baby. Your hands are now ready to touch the patient. Some important steps to be remembered are: soap and alcohol-based hand rub should not be used concomitantly. Nails should be cut. Do not wear a nail paint. Remove all jewelry, that is rings, watches and bracelets before entering the SNCU. Never use common hanging towel for drying the hands. Thank you.